Hey guys, welcome back to the channel. This is Side Dental Vlogs and I'm Dr. Abhishek back with another video. And if you don't know me, I am Associate Professor in Department of Oral Medicine in some hospital Bhubaneswar. And today's topic will be which branch of MDS you should take admission in, and what is the best branch for girls, what is the best branch for boys, which is the more money fetching branch, which non-clinical branch is good for you, which clinical branch is good for you, what are your interests. So we'll cover all the points. So you have given NEET and congratulations to you all those who have got ranks in government colleges and private colleges. Some people are confused like whether they will get a seat in government college, some are confused whether they will get the desired seats or not. So this is a big question because many people from the heart they want to become an oral surgeon, many people want to become an orthodontist, many people want to become an implantologist, and they get confused if I want to do implantology, if I do in perio, if I do in prostho, what shall I do? So guys, this video is all about MDS, which branch is good, which branch is okay, which branch is good for girls. So suppose you have got a college in government seat, you have got a college and you are getting a rank in which you will be not getting oral surgery or orthodontics or perio, but you will be getting a non-clinical branch. Similarly, you got a private college admission as well. So paying a fees of government college is quite less and paying of a private college MDS fees is quite high. So you have to set your priorities here. Suppose you want to do oral surgery from your heart and in government college you are not getting it. So what my suggestion will be, you go for the oral surgery branch in a private college, because whatever your heart says you should do regarding dentistry, because this will be your career, entire life you have to do. You may get some non-clinical branch in a government college, like suppose you get oral path or community or oral medicine, but your heart is in oral surgery, right? Even if you take a loan and do a private college MDS and you do oral surgery, that is quite more worth than doing a non-clinical branch in a government college. Well, if you do get a very good rank in a government college, that is quite good. Or you will get ortho medicine, or you will get perio, pedo, whatever clinical branches you desire, right? So this is my first point, because many people were asking me, sir, मेरे को ऐसा situation है तो मुझे क्या करना चाहिए? So I am just giving a suggestion. It's not exactly, it's my opinion. It's an opinion can differ from person to person. So many people were asking this also, which is the most money fetching branch? So that doesn't depend upon the branch, that depends upon you. What is your interest in work? How skillful you are? What are your soft skills? See, money doesn't come from doing a very good MDS in a very good college, right? You have to develop the soft skills. Patients आने चाहिए आपकी क्लिनिक में, तभी जाके आप पैसा आएगा ना. आपने MDS अच्छे कॉलेज से कर ली या फिर आपने बहुत अच्छे ब्रांच में MDS कर ली, तो उसका मतलब ये थोड़ी ना है कि आपके पास पैसे बनेंगे. That depends upon what are your soft skills, how regular you're going to your clinic, how consistent you are, and skills भी है, okay? How you are doing advertisement of your clinic. But regarding MDS point of view, even if you do a oral medicine MDS, you can shine in clinical practice. I have seen many dentists who are oral medicine practitioners, oral pathologists who are doing very good roaring practice. Okay, so ऐसा कोई मतलब नहीं है कि आप कोई पर्टिकुलर ब्रांच में MDS कर लेंगे तो आपको क्लिनिक नहीं चलेगा, right? ऐसा कोई जरूरी नहीं है. But हाँ, what I feel from my heart, which out of all the MDS branches, which gives good treatment plan to a patient. Now in dentistry, which thing gives you more money, right? If you are owning a dental clinic or या फिर अपने clinic में काम किया होगा, you know, giving any sort of dentures, if you give FPDs तो ज़्यादा पैसा आता है. If you put implants and put prosthodontic teeth over there, ज़्यादा पैसा आता है, right? If you are giving lot of RPDs, तब भी ज़्यादा पैसा आता है, right? RCT में क्या होता है, आपको बहुत you have to work on the patient. The same patient will come again 3-4 times and the RCT has to be successful. Then you put a single crown. But what you are doing in prosthodontics, you are putting multiple teeth together. You are giving a total implant, full mouth rehabilitation you are doing. So what I feel ki if you do MDS in prosthodontics, you will be able to learn good prosthodontic work, good implant prosthodontics, and you will be able to fetch good money. Because you have a good treatment plan for the patient with CD or RPD or cast partial dentures, right? So for me, I like prosthodontics very much, and I want to learn more prosthodontic work. But since I am in oral medicine, I am not too perfect in prostho. I do prostho work, but I'm not that much great in that cast partial denture. I have never made all those complicated procedures. I call a consultant for implant cases and all. So what I feel कि doing MDS in prosthodontics will fetch you more amount of money. हाँ, आपको अगर इंटरेस्ट नहीं है तब फिर कुछ नहीं हो सकता है. ओके, ऐसा कोई ब्रांच नहीं है जिसमें आप पैसा नहीं बना सकते हैं. इवन इफ यूर ऑर्थोडोंटिस्ट यू कैन डू RCT. इवन इफ यूर रूट कैनाल स्पेशलिस्ट यू कैन डू CD. It's not like that you have to be only doing RCTs to get good clinic patient flowing, right? Now let's come to what is the bread and butter of dentistry. The bread and butter, 90% of the people are having carious teeth, right? So carious teeth means either you have to do restoration or you have to do root canal treatment. And Indian population, they are very less aware of dental treatment still now, after there are so many dental colleges and clinics. So root canal treatment is the bread and butter of dentistry. आपका घर चलाने के लिए, आपका क्लिनिक चलाने के लिए, you need to know root canal properly. So second choice of branch for me is endodontics, because what I feel RCT आपको एक क्लिनिक में एंडोडोंटिस्ट तो होना ही चाहिए, और किसी एक ना एक को तो अच्छे से RCT करना ही चाहिए, either you or your wife or the dental assistant or technique, because you cannot rely on consultant all the time, right? Because consultant will be giving you a time. Suppose a patient comes on a Monday and consultant is not available on that day. You can even start the root canal treatment. That's not a big issue. You can do the treatment protocol. So these are few things which has come into my mind, so that I made this video. And I have made a video after a long gap because I am taking a break, and I was not well from past 2-3 months, and few other things were going on. So some other projects were also there, still pending projects. And I'm going to Banaras, by the way, from 31st to 3rd, and again to Raipur. And I'll be updating in my Instagram. My Instagram ID is sai_dental, and you check regular updates. I give photographs of various oral lesions. I make short stories, short videos, and short clips also as well regarding implants and all. So next we come on to oral surgery. Now oral surgery is a very promising branch, is a very challenging branch, and there are various aspects of oral surgery. Like, for example, if you want to totally go into implants, if you want to totally go into fracture. I have a friend of mine in Delhi. You must be knowing his name is Chandraveer, and from the very beginning he has not done any job. He's only placing implants and doing fractures and doing tooth extraction, nothing else, and he's getting good money from the patients. He's only doing implant practice. He's also having his own clinic, but that is run by his colleagues or his wife. I don't remember. But oral surgery, ये एक scope है oral surgery. Another part of oral surgery is into, if you go into plastic surgery, or if you go into cancer surgeries, or if you go into all the facial rehabilitation, like facial reconstruction, and also about cleft lip and cleft palate. So that is another direction of oral surgery, right? So oral surgery, there are 2-3 pathways you can take. One is the cancer pathway, another is the fracture pathway, another is the facial aesthetic pathway. So many oral surgeons, they have chosen a different good pathway. Like for few oral surgeons, they take fracture and cancer. Few oral surgeons, they totally are into reconstruction, and that fetches a lot of money. ऐसा नहीं है कि एक पेशेंट आपको करना है, एक पेशेंट ही आपको 25-30,000 you will be doing surgeries. So huge amount plus huge risk as well. Right? Now you ask me, is oral surgery a good branch for girls? It is a very good branch for girls, but the girl should know how to balance the life, because girls will get married, they'll have kids, right? When they have kids, they won't be able to go to the clinic and perform procedures. So that is a problem with females, little bit. What I feel, oral surgery, initially it is very nice, but with time what happens, if you are not able to give your 100%, then what happens, frustration comes in and you are not able to work, right? So because oral surgeons, they have a responsibility, they have to go on calls at night also, 2 a.m., 1 a.m., right? You have to be ready for that. It is a good branch for girls, but girls should take up any other branch which doesn't involve night duties and other emergency duties, because in the future you may not be able to go. That is the only problem, that's all. Then next come periodontology, which is a very good branch of dentistry. It's very good for girls and boys as well. there is no good thing for girls and boys. It is my opinion, which I feel. Okay, you can choose any branch you like, anything you can take, right? This is just my opinion, which I feel. That's all. Now next is perio, in which all the flap surgeries you'll be able to learn, and these are very specialized procedures, right? Even I call a perio consultant for all the bone grafting and flap procedures. And each and every ideal, see, whenever there is an implant case coming to the clinic, patient is having a lot of money, but patient is not having bone. Patient का हड्डी रहता है लेकिन पैसा नहीं रहता है. समझे ना? वाइस एंड वर्सा. You understand the meaning? A patient comes to your clinic and at that time he wants to place implants. He's having a very good bone width and everything is very nice, but patient doesn't have money to place implants. But similarly, another patient comes to your clinic with no bone support and there is a lot of problems, but still patient is ready to pay anything. So this is the situation usually I face, right? So periodontology is a branch in which you will all learn bone grafting procedures, all the GTR membrane, all the suturing techniques which are very much required in while placing the implants, right? Orthodontics is a very good branch. Orthodontics is a very less risky branch, and you do the aesthetics of the patient. Once you become famous, thus the patient starts flowing. Once the patient starts, suppose you have 50 to 60 ortho patients in your clinic, every patient, appointment patient is giving you 2,000, 3,000. So there is no problem, money is inflowing all the time, right? So you should do MDS in a branch in which you are passionate about, right? I was passionate about endo, but I didn't get, and my priority was getting a government college. That's why I was also getting another branch, many other branches like pathology, prosto I was also getting, but that was a permitted seat at that time, and I got scared ki if I take a permitted seat it may not get recognized. Eventually it got recognized in GDC Kottayam, but still out of fear I could not choose it. I chose oral medicine, and for me at that time doing a job was more priority, and going into a government college where the fees was less was more priority, so I chose. So you have to set your limits, set your boundaries, and choose your branch. Pedo is good, oral pathology is also good, oral medicine is also good, all branches are good. There is no branch in which you cannot shine. I know each and every person from different branches who are principals, who are professors, who have a roaring practice. So only thing, you have to work passionately, you have to feel compassionate for the patient, and you have to give something to the society in return whatever you have studied. So that's all with today's video. I hope you like this video. Till then, take care. Bye bye. Love you all.